Good morning. I will call the Fiscal Committee meeting to order for April 21st, 2023. And first, we'll recognize the Legislative Budget Assistant, Michael Kane, for an explanation of a proposal on changing some of our rules.
Sure. Thank you. Good morning, Mr. Chair, members of the committee. For the record, my name is Michael Kane, the Legislative Budget Assistant for the state of New Hampshire. Item number one on your agenda is a request to amend the Fiscal Committee's rules and procedures, and this is what directs our office to what we can and cannot include on your agenda. So the request before you, there are two options, and the request is basically for the months of May and June to allow items that utilize funding from the American Rescue Plan or the Bipartisan Infrastructure Law or any other previously enacted federal relief bills to be authorized through June 30th, 2025. That statement is basically saying if I receive an item, or in DAS receives an item that goes beyond June 30th, 2023, it has to be related to these buckets of money. And then we would allow it on the agenda, which then the committee would take a vote at that time to either approve or deny.
So does everyone understand? Normally, we're only dealing with the present biennium. However, every member of this committee is going to be a vote for or against the budget for the next biennium. So it isn't as if we have no control going forward of those funds because we'll all be in some manner voting for them. So although this is an exception to what we do, I think that in my mind, it's still something we are in some control of. It does save a lot of paperwork and perhaps layoffs that might otherwise occur should we not approve one of these options for changing in our rules. Discussion among the committee members.
Move the question.
Senator Bradley moves that we adopt
Question. You have to pick one of the
option 2. Have you looked at the two options? Is it for option 2 you're moving, Senator? All right. And Senator Rosenwald seconds that we adopt option 2. Is there any further discussion? All in favor say aye.
Aye.
Opposed, no. That is adopted.
Thank you.
All right, moving on to the rest of our business. Under tab 2, acceptance of the minutes from the previous meeting of March 24th.
So moved.
Senator Gray moves to adopt.
Second.
Senator Bradley seconds that we adopt the minutes. Any additions or corrections? Seeing none. Further discussion? All in favor of adopting the minutes as written, say aye.
Aye.
Opposed, no. The minutes are adopted. We don't have any old business to deal with. We have a consent calendar that goes through tabs 4, 5, 6, 7, 8, and 9. There are 24 items. I'll tell you the items that I've been asked to remove, and if you have some that you've asked to remove that I miss, please tell me so. Under tab 6, I'm removing 23-110, 23-111, 23-122, 23-137, 23-138. Under tab 7, I'm removing 23-128, and under tab 8, 23-112. Under tab 9, I'm removing item 23-124. Are there any other items that any member wishes to remove? Senator Rosenwald.
Thank you. Under tab 9, has item 1, 2, 3 been withdrawn?
It has been withdrawn.
Okay, thank you.
Yeah, we have a note to that, so that's
Yep.
not
Thank you.
on our agenda at the present time. Any other items? Seeing none, I'll entertain a motion to adopt the rest of the consent calendar with the exception of the aforementioned bills.
So moved. Second.
Senator Gray moves, Senator Bradley seconds that we adopt the rest of the consent calendar. Any further discussion? Seeing none, you're ready for the question. All in favor say aye.
Aye.
Opposed, no. The rest of the consent calendar is adopted. We will move to tab 6. And the first item that has been removed is 23110, Department of Business and Economic Affairs. Do we have someone here to answer questions? Taylor Caswell.
Good morning. Taylor Caswell, Commissioner.
Representative Erf has a question on the item.
Yes, sir.
Do you want to consider them separately or together?
Yeah, no, this is also related to 23122, so it might be well to discuss them at the same time.
So instead of asking this question twice, I'll just ask you once. So what does equity have to do with broadband, and why is that a consideration in accepting these federal funds?
So what we've been dealing with to this point has been funding that's provided to the state through ARPA and the Capital Projects Fund. Those were the items that we had before you last summer and then again last fall. These funds are now shifting us over to the Bipartisan Infrastructure Law, or BIL, or IIJA, or whichever acronym you choose. This is a different pot of resources. Included in that law is a funding source to assist states in this matter of digital equity. So in most cases in our industry, what we're going to be looking at is the fact that we're going to be hooking up a lot of rural communities, both with the previous funds and with the funds that we have yet to receive. And as part of that, there is an initiative within the federal law that would allow for assistance for people who are not used to dealing with digital interactions. So an example would be for elderly populations that would be using telehealth or getting access using a laptop or a computer. It would be funds that would be allowed to, used through the state to help those individuals access the digital component of the broadband hookups.
So I'm going to talk about these together now, just so I understand what's going on. This is for $500,000. The other one's for roughly. The other one's for $2 million. Maybe you could just describe the differences between the two. But more importantly, the question I have, based on what you just said, was: are we talking about some of the funding, maybe that $2 million, being to provide support to the individuals who need this help, or are we making decisions about who gets the broadband access based on some sort of equity?
No. Nothing to do with the former. This is exclusively about helping people access the internet using the hookups and the funds that we'll be using to connect those locations. So it's not deciding who gets the broadband. It's assisting people once they have it, how they use it, right? So that's the primary purpose of the Digital Equity Fund. The other item under 122, that is a requirement to get access to the next tranche of funding under the BIL for continued activity in driving more broadband infrastructure in the state. So there's a significant amount of money that would come as a result of us completing that study, the $2 million item. We don't know what the final number will be, but we do expect that it would be in excess of $100 million additional to what we have received already.
So if I'm not mistaken, and I don't have it right in front of me, I believe that one also makes reference to broadband equity.
So both of them refer in many places to the whole digital equity component under the federal law. The thing to bear in mind is that these two items will result in access to two different pots of money, but they are both under that federal BIL moniker.
So does that mean the word equity is just, that's in the title of the federal law or whatever? That's nothing to do with what the second pot of money is about? What is the second pot of money about? The $2 million, what is that actually
So
for?
the BEAD funding under the section, if I had a chart, it would be a lot more helpful. So we have the bipartisan infrastructure law, the infrastructure legislation. Within that is the broadband. The BEAD program. Within BEAD program, there is a digital equity component, and then there is the infrastructure expansion component. We're talking about both of them here. The digital equity, we're requesting $525,000 to pay a contractor to write the plan that will then be submitted to the federal government, which should unlock funding for digital equity activities that I described earlier. The other pot of money, the $2 million, would be for a contractor to design a plan that we would then again submit to the federal government, and upon their approval would unlock another pot of money. That would be the $100 million item that I referred to earlier, and that's for the infrastructure investments themselves. I hope that makes some sense.
No, that does make sense. But now let's stick with the $2 million piece, the plan being, because the title of it is for broadband equity access.
Yeah.
So I'm just wondering now, does that plan that you're developing need to be related to equity in some form as far as how the broadband access is going to be provided, as opposed to an approach that gets the biggest bang for the buck? Because now you're talking about, if I understand what you just said, now you're talking about getting another tranche of money to actually install broadband.
I understand your question. Our understanding right now is that the equity component is referring to people having access to the internet, not access to the broadband itself. We will continue on the track that we are on currently, which is expanding access to unserved and underserved areas of the state with these resources.
In another forum I went to, here they're going down a road, and if someone has 1,000-foot long driveway to get to their house, they exclude them because they won't want to spend the extra money to send that much wire, might even require another pole. So equity means you don't skip them. You're going to give them access as well, even though they might have their residence further from the road that you're running the wire down. So that's what the equity is. You got to cover everybody on the road, not just the ones that are close by. That's my understanding.
Yes,
Does that
sir.
seem right?
That would be a correct interpretation. We are making sure that people get that access. We're currently in that instance that you described. They would basically be charged for that 1,000 feet of their driveway, whereas that would not be the case with these resources.
Thank you.
Certainly.
Representative Leishman for a question.
Thank you, Mr. Chairman. So several months ago, we were approved dozens and dozens of millions of dollars for broadband expansion. We had a number of people sitting here encouraging us to vote that way. Has anything happened there as far as, have you put contracts out? Has expansion started?
Yes, in both cases. So you'll remember there were two. The first one, a Broadband Connect program, we'll call it round one, was awarded to the New Hampshire Electric Cooperative. They have already begun work. They have, I think they're in 50 different communities. They're doing work right now. They're ramping up this spring to be able to put, they tell me, 20 miles a week of fiber out in the communities. The second contract was awarded to Consolidated Communications. They are already beginning their work in planning for this summer's construction season. Both of them are under pretty strict time restrictions because these are ARPA funds, so they're moving quickly. Right now, what we're seeing, what we're expecting from both of these contracts is to be able to connect 50,000 new locations in New Hampshire that are either unserved or underserved and get them to high-speed internet.
Chairman.
Senator Rosenwald for a question.
Thank you, Mr. Chairman. So is this going to be one contractor who gets two contracts? I'm trying to figure out, one is like you get the broadband so then you could watch TV or maybe have a digital phone and internet, and the other one is teaching people to use the internet.
Well, not so
Is
much
it?
to use the internet, but with the high-speed internet in communities that don't have that capability right now, you have people that have not had the experience necessarily of using their computer to talk with their doctor or to manage their finances or to do those sorts of functions. The federal law included resources to help states meet that meet the requirements of those individuals. So that's what the item 110 is for. That is to hire. We'll put out an RFP for a consultant to complete that plan on our behalf, which would then be submitted to the federal government. If it's accepted, then we unlock some resource for that particular purpose. It's the same process for the second item, 122. It's for a third-party contractor to write a plan, which then, to meet the federal requirements, we would submit that to the federal government, and then that unlocks an additional resource for the infrastructure build-out.
Further questions? Remember, we are discussing both items 23-111 and 23-122. I'm sorry, 23-110 and 23-122. Any further discussion? I'll entertain a motion to adopt 110, 23-110.
I'll move both items if you want.
All right, that'll be fine. Representative Erf moves both Representative 23-110 and 23-122. Second by Senator Bradley. Further discussion? Seeing none. Are you ready for the question to accept these two items? All in favor say aye. Aye. Opposed, no. Those items are adopted. Excuse me. We're moving to 23-111. And we also have questions on that, Department of Health and Human Services. Excuse me. Mr. White, welcome.
Good morning. Nathan White, Chief Financial Officer with the Department of Health and Human Services.
Good morning, Tricia Tilley, Director of Public Health.
Good morning. Representative Leishman had questions on item number 23-111.
Thank you, Mr. Chairman. Thanks for taking my question. On your page 5, it lists the state agencies that are receiving grants, or states or Indian tribes, etc. And I was just curious, looking at the comparison between Maine and Vermont are receiving a lot more money than we are. Is that because of eligibility, that more people in Maine are eligible versus New Hampshire? I'm assuming that, but I just wanted to make sure.
That is correct.
Okay, that's simple. That's all I have, Mr. Chairman.
That mean more children or more low income?
A proportion of, we would certainly a greater proportion of low income.
Thank you. Senator Rosenwald.
Thank you. Are we reaching every eligible person in New Hampshire and we just have fewer eligible, or are there things we could be doing?
Sure. So we are certainly not reaching every eligible person in New Hampshire. Let me rephrase that. Everyone who is eligible for WIC does not participate, is probably the safest way to say that. We have been doing extensive outreach efforts. We believe we've actually seen an uptick after years of declining enrollment. We are now seeing an uptick again. We think that's in part due to the pandemic. It may also be in part right now as SNAP benefits decrease. People are coming back to using WIC as well, because WIC is, SNAP is a cash benefit, WIC is a food package, so it's a little bit more complicated, or at least restrictive, than cash benefits.
Further questions from the committee?
Move the item.
Representative Leishman moves the item. Senator Bradley seconds it. Further discussion? Seeing none. You ready for the question? All in favor say aye. Aye. Opposed, no. We've adopted item 23-111. Moving now to 23-137. This is the Department of Administrative Services. Welcome.
Good morning. I'm Sherry Rockburn. I'm the Assistant Commissioner for the Department of Administrative Services.
And this was someone had a question on the food distribution warehouse. Again, I believe it was because of the fact that there seemed to be a big difference, or even though the last item had a big difference in qualification among the New England states. This was a different kind of alignment. And we wondered why one program is affected by the poverty and this one less so.
So I can talk a little bit about the, oh, I'm sorry. I didn't
On
know it said-
attachment B,
Yeah.
New Hampshire this time has about the same amount of money as Rhode Island, and about half as much, or less than half as much as Maine, and obviously a lot more than Vermont. So we're wondering about the different criteria that they vary from state to state. We saw in the last one that the other states seem to have more poverty. Now that's not the case. So what is this based on?
Yep. The director was unavailable to be here this morning, so the questions that I thought were coming through the LBA was about the program itself and the commodities, so I brought that information with me. So let me find out a little bit more about that mechanics of the program in terms of why our dollars would have changed. Senator?
Senator D'Alessandro.
Thank you, Mr. Chairman. Yeah, I did have a question about the commodity distribution program, and what was happening with regard to that. I've been involved with that for a long period of time.
So I can speak to that. In terms of the program itself and the formula, I can try to get that answered before the end of the meeting to get back to you on that. In terms of the program itself, we receive funding through the federal government for assistance for food service. We contract with one organization. It's the Community Action Program of Belknap and Merrimack. And the funding that we receive is both for administrative costs to run the program and then also sort of the value of the food. That organization, the warehouse is located on Industrial Drive up in the Heights, sort of near 106 or 106. The food gets delivered there from the U.S. Department of Agriculture, and then it gets distributed to local organizations throughout New Hampshire, food banks, pantries, et cetera, homeless shelters. In fiscal 22 last year, we received about 4.3 million in food value. This grant, or the item in front of you, is to accept additional money for the administrative costs of the program. And I do have a list. I sent it through the LBA, but can provide it to all of you if you haven't seen it, is the types of commodities, which really range from almonds up through peanut butter through chicken. So it really is, both perishable and non-perishable goods.
Okay. Thank you. Thank you, Mr. Chairman.
The other puzzling thing was, why did Administrative Services get involved rather than HHS?
I don't know if I don't know the answer or if anyone at HHS knows that. It goes through our department. I don't know the backstory on that. It's been running through our department since the inception of the program. So I'd have to do a little digging of why our agency ends up being the recipient.
Further discussion from the committee? I'll entertain a motion to adopt
Move the item.
23-137. Motion by Senator D'Alessandro, second by Senator Bradley to adopt the item. Further discussion? Seeing none, are you ready for the question? All in favor say aye.
Aye.
Opposed, no. The item is adopted. Next item, number 23-138. This is HHS. Representative Irf had a question.
I have several, if that's okay.
That's fine.
The first one I think is easy. Where are the three centers located?
Sure. I'm sorry, I turned it off instead of turning it on. So good morning. I'm Katya Fox. I'm the director of the Division for Behavioral Health. And the centers that are, so there are three centers, as you indicated. Manchester received a planning grant, which has actually concluded. And then the other two that have current grants are Nashua and West Central Behavioral Health, which is in Lebanon.
Sorry, I have to write too many things down here at once. Okay, so the next question is, it makes reference to developing new Medicaid payment systems. Can you tell me what that means?
Yes. So, as part of this process, there are certain requirements about how the clinics are set up. So, they have criteria, and I think some of that is included in this request. There is also a requirement that we look at how we reimburse the centers in this model. So, that is why some of the funding is going to go for our actuary to be able to help us with that, but it's on the premise of a prospective payment, which is the way that we currently fund our federally qualified health centers and our hospitals.
Thank you.
And Henry Lippman is here if there are more Medicaid funding questions.
Maybe let's go to him then. So it also talks about improved models and infrastructure for data and metrics tracking and quality oversight. So I have two questions related to this. What metrics are being tracked, and how will we and the public be able to see the results of that tracking, i.e., so we will know that you're being successful, that the program is successful or less successful?
So again, thank you for that question. This is going to really provide us the outcome data that we've all been searching for. We often have that process data, and we count how many people served and ages and demographics and things. But this will allow us to look at outcome data to see how successful the clinics are in their work with individuals.
And the second part of that was, and how will we, the legislature and the public, also be able to understand how successful they were?
Absolutely. We have reporting requirements, but beyond that, it's really important for us to be sharing that information so that you'll have it, we all have it. And we've done a lot of work within the department to create dashboards and to create accessible data for transparency and for the public to see how we're doing. So that will be part of this process as well.
Great. I hope when we do the budget in the next cycle, at the very least, we would see that kind of feedback. at that point.
Absolutely.
Thank you
We
very
all
much.
need it.
Thank you.
Senator Rosenwald for a question.
The prospective payment system, that's a higher reimbursement rate, isn't it? It's sort of I don't know, I think the community health centers, they get a higher level of payment. Do you know what the differential is in amounts that maybe would increase funding to these community mental health centers if
do
we
not.
went to the prospective payment system?
Yeah, I think there are a lot of discussions and a lot of theories of what that would be and what that would look like and how much more it would be. I do not have that information because that's the purpose of the planning grant, is to go through that process. What we want to make sure is that the providers are paid for the services that they're delivering and that it's high quality care and there's access for individuals. So whether that is going to be more, we know we have the budget that was passed by the House and into the Senate that has significant Medicaid rate increases, which goes a long way toward helping our providers in the community. And if Henry wants to stand up behind me, he's welcome to, but he has more experience in this payment methodology than I do because of the providers we're talking about.
Good morning. For the record, Henry Lippman, the state's Medicaid director. I think we do have to do the actuarial work, but the basic gist of the model that's being evaluated is to provide a more stable funding to community health centers so that they can make the investments in staffing and what have you. We currently work under sort of a two-level system right now, one where there are the fee-for-service rates, plus under the managed care program, the CMHCs participate in a capitation contract, so it's hard to know whether someone's going to be better off or worse off with respect to their finances until we do a little bit more analytical work here. But generally, I think the funding source is intended to provide a little more certainty in terms of streams of funding so that I think they can invest in the services to make the better outcomes. And certainly, it would be part of a budget that you would get to vote on in subsequent years.
Representative Erf.
Move the item if there are no more questions.
Representative, excuse me. Representative Erf moves 23138. Senator D'Alessandro seconds. Further discussion? Seeing none, are you ready for the question? All in favor say aye. Aye. Opposed, no. That item is adopted. Moving on to tab 7. The next one I had removed was 23128, Department of Energy. Good morning.
Good morning, Mr. Chairman, members of the committee. For the record, Josh Elliott, Director of the Division of Policy and Programs with New Hampshire DOE.
Senator Erf, Representative Erf, did you have a question?
Yes. So I'm only vaguely familiar with LIHEAP. I know what it is and what it's all about, and it's been going on for quite some time. So my question is not related to the funding for that. That's obviously great as far as I'm concerned. But what is your current staffing for running this program, and why do you need more staff to run a program that's been going for quite some time, as I understand it?
Sure. Thank you very much for the question. So our current staffing, we have 2 staff members who currently 100% of their time is devoted to this program. We are requesting a third staffer in order to help improve efficiencies in the program. Again, you're seeing, over $80 million just being handled by 2 folks. You have the increasing complexity with federal requirements on this program. We've had additional duties assigned based on the federal grants, including setting up a water assistance program as part of LIHEAP. So we're seeing great increasing complexity with complying with federal requirements for this program that necessitates adding a third staffer who, again, will be able to improve efficiencies. Current staff is pretty stretched thin as it is, so it'll give us a little bit of breathing room.
So if I'm not mistaken, this is a temporary full-time position. Does that imply that this is only temporarily needed, or what's going to happen at some point in the future?
We will, thank you for the question. So we will evaluate over the course of the next biennium. Obviously, there will be an item to re-up this once the new biennium starts. We'll take a look at this once we come in for not the current budget, but I should say not the current budget under consideration, but the subsequent budget after that, as to whether or not either federal regulations have changed, there's some other changes with the program, and either we'll see what we need in terms of staffing at that point.
Thank you.
I see you have several write-ups on this program in this single audit, federal audit. So is this person going to possibly help with some of those write-ups that have been brought up, some of them the second or third time?
Yes, thank you for the question. Yes, having those extra staff will make sure that we're following everything to the T. We'll make sure we're communicating with our business offices, make sure that we're following all federal regulations to the T.
Further discussion from committee members? Senator Bradley moves so you adopt the item. Senator Rosenwald seconds. Is there any further discussion? Seeing none, all in favor say aye. Aye. Opposed, no. The item is adopted. Moving on to tab 8. Item 112, 23112 is from the Department of Health and Human Services again. We have Mr. White and Mr. Ribson. Representative Erf, did you have a question?
Thank you, Mr. Chair. So why are we specifically concerned with, and this is a quote from the document, the mission of OJJDP is to reduce the number of minority youth disproportionately serviced in the juvenile justice system, quote, end quote.
That's been a core mission of OJJDP for, as far as I know, decades. And the reason why it's been a core mission is that nationally there has been great disproportionality in terms of minority youth in the juvenile justice system and in the adult correctional system. So one of the core focuses of OJJDP and a requirement of the federal grant is that states do work to look at the disproportionality within their systems and try to do work to help find ways to reduce the disproportionality within their systems.
So I'm assuming we're talking about SysC, but other things, but primarily SysC. And we obviously had a lot of recent discussions about who should be in there and that sort of thing. And I've had the impression that the decisions regarding who should be in there have nothing to do with race or ethnicity or anything of that nature. So I'm wondering why, we need to look at this.
So the juvenile justice system is a lot bigger than just the facility. But I do have data that shows here, and it's consistent nationally, that minority youth are disproportionately part of the juvenile justice system, whether that's at the arrest decision point, at the decision point to file petitions, at the decision point to put a young person on probation, at the decision point to put a young person in placement, or at the decision point to have a young person be detained or committed. Not because explicitly race is a factor in those decisions, but those are the outcomes that we see in the data. And that's the reason why, for, again, going back, I think 20 plus years, this has been something that OJJDP has required states to consider and try to find ways to mitigate.
Isn't it possible that it's because they commit more offenses that put them into that situation?
I think there's a lot of things that are possible, but I think there are probably many contributing factors to why we see those outcomes. And I think there are probably, underlying factors that cause those outcomes as well, in terms of the types of supports and services that are provided to different communities, as related to, historical, inequities in the way that folks have been treated over time. I think there's lots of things that result in this impact, but nevertheless, the impact is seen in every state in this country.
So if that's the case, will there be something you produce that we all will get a hold of to understand if in fact that is the case, that it's because of race that people are being inappropriately put into the system?
I want to be very careful. I'm not saying that they're being put in because of race in terms of it being an intentional decision that people are doing to put, to make these choices. What I'm saying is that the outcome in the data, which I could produce and have a whole meeting on it if we want, shows that this is true in both the child protection and the juvenile justice systems.
So I'm not questioning the data. I'm questioning I'm asking, is what's coming out of this an explanation of why we're seeing the data? And I'm quite honestly, I'm less concerned with historically 20 years ago and more concerned with currently. Because it seems to me there's an implication here that there's something other than the people that are there are committed or found guilty of offenses based on something besides the fact that they did something wrong.
Yeah, and again, right, understanding the decision making that individuals make at all these different points, at the point of first contact with law enforcement, at the point of arrest, at the point of whether or not to file a petition, at the point of whether or not to find that petition true and to have a young person go on probation or be placed or go to SYSC. All of those decision points, there's lots and lots of factors that go in there. I don't have the ability to pick apart every decision in every case and tell you why those decisions are made. What I can tell you is that the outcomes are what the outcomes are. And the goal of this is to look at trying to find ways to mitigate that. Now, we are actively trying to find ways to mitigate that right now. The Juvenile Justice Assessment Program that we've spent a lot of time talking about on the House side in particular, which really has the goal of identifying youth needs early and making sure that youth are connected with resources early before they get pulled deeper into the juvenile justice system. Part of the goal of that is to try to help impact this, because we also know that minority youth are less likely to have access to some of those types of supportive services in the first instance. So you would be able to hopefully divert some of those folks to get the supportive services they need and prevent them from ending up deeper into the juvenile justice system.
Let me be more direct. Will you be providing us a report on what you find? Whether it's whatever the factors are, will you be telling us what these factors are so we understand what in fact is going into all these decision points you're talking about that you say right now you're not aware of what they could be?
It's a much more complex. If I knew how to answer that question as to why we see disproportionate racial outcomes across so many systems in this country, I wish that I could answer that question. I do not have the depth of knowledge to answer that question. What I can tell you is that there's a committee that just met yesterday with Assistant Commissioner Eddie Edwards at Safety, with partners from across the state that look specifically at this information and review the data about what we're seeing and try to figure out what are ways that we can try to better impact this outcome.
But as a result of that, can't you report on it? What you found? I mean, it seems to me that if there's a problem and you're correcting something, you must be able to talk about what you corrected. In other words, you keep saying it's so difficult. I get all that, but what I'm not getting is why we can't learn what these issues are.
Yeah, I have, as I said, I've put together a pretty comprehensive deck of data on exactly this point. I'd be happy to come in and talk through both the data and both the things that we think are impacting that. I think I'm probably not the only person who could have that conversation. I think there's a lot of people who have done work in this space in this state that are probably even more qualified than me to be able to go into that, including many of the folks that sit on this committee that met yesterday morning or yesterday afternoon.
Some of us think the causes are more tied with poverty, neighborhood, and fatherless homes rather than race. And rather than trying to attribute to that single factor when all these other ones seem to be in play, that we think that should come in that study. Further discussion from committee members.
Move the item.
Senator Gray moves. Senator Bradley seconds to adopt the item. Further discussion. Seeing none. All in favor say aye.
Aye.
Opposed, no.
No,
Wish to be recorded?
I recorded myself.
All right. The motion passes. Moving on to tab 9. We have an item 23-124. Department of Health and Human Services again.
Good morning, Karen Hebert for the Division of Economic Stability for DHHS.
Nathan White, Chief Financial Officer.
Representative Erf for a question.
Tired of me yet? I think this is the last one I'm going to get into. I'm just curious as to, this is all about mortgage, lease payments, deferred maintenance, and so on in terms of what the monies are covering. And I'm just expanding outdoor spaces and so on. But the title of this, or the lead-in, if you will, the headline is, it's to strengthen workforce, which I assume means be able to bring more people in to do the job. Could you just speak to how the one helps the other?
Sure, it's a great question. Thank you. So this is entirely about strengthening the workforce. And the intent behind this basically is with the reduction in operating costs, such as mortgages and the other examples in this, would free up funding in order to pay either higher wages or better benefits for the workforce for the purposes of strengthening the retention and recruitment efforts that are so needed in childcare providers.
Follow up.
So when you distribute the funds, is there going to be some tie-in or expectation that the result of the savings up to the childcare centers will be that money gets reinvested in staffing as opposed to just reinvested in themselves?
Yes, correct. So we're putting the details together now, but we really want to develop a formula that is fair and equitable, but providers will need to demonstrate or provide that verification that they did reinvest the funding into their workforce.
Thank you.
You're welcome.
Senator Rosenwald for a
Thank
question.
you. Some of this infrastructure building seems like it will take some time. Wouldn't it be faster to just invest these resources into the workforce, either through, I don't know, enrollment-based payment or stipends or something that would get the money to these centers, to the workforce more quickly? Why are you approaching it like it's not the first result, it's the second result of the money following up on Representative Earth's question. It just seems like it's going to take longer and is more indirect.
Sure, thank you. Another excellent question. So this is a multifaceted issue, which really needs a multiple solutions that are both short-term and sustainable for the long term. So the department put together the Child Care Strengthening Plan last year as a result of Senate Bill 446. There are many initiatives that were mentioned in that strengthening plan. This is just one of them. And this is the one that Gopher had provided the award for. So in addition to that, we do have a number of initiatives that we're implementing now that may address exactly what you're referring to, that are more immediate. And that is through the ARPA discretionary funding. So the state is currently putting together a number of procurements to address a number of the other initiatives, including a recruitment and retention project that would essentially provide a pilot program with effective strategies for attracting, retaining, and increasing the recruitment and strengthening the workforce directly.
Thank you. But part of the problem that we hear is the capacity issue. So why does creating playgrounds increase capacity for the number of children that can be cared for in these facilities? I'm just not seeing that connection.
Sure, great, thank you. So the idea behind something like a playground, so if there is a provider that essentially doesn't really have that kind of facility, but they have plans that they would like to be able to provide, something like a playground that needs to be appropriate. It needs to be age appropriate and of quality. So if they have plans that they're implementing that, and that is where they are investing, but at the same time having this problem with recruitment and retention so that they're not able to bring in the right number of staff or keep the right number of staff that would match their capacity. So there are a number of programs that are operating under capacity because they don't have the workforce to take on more children that they have slots for. So by investing in something like covering that kind of an operating cost that would significantly improve a provider's facility, that would free up those funding so that they can provide, they can allow for greater wages or better benefits that would attract more people into that particular industry. With that, there are a number of other initiatives going on at the same time to really look at the different pipelines of where can we really recruit people from. A number of partners that we want to start to invest in, including the business community, where we can really look at ways of partnering with businesses so that we do meet the needs of those businesses and employees that would be working in providers. Is that helpful?
One more follow-up. Why didn't the department ask for money to do those things rather than this longer term and more indirect approach?
Our request for, in the Child Care Strengthening Plan that was submitted to Gopher, also provided to the legislature, we asked for a number of items, including funding for recruitment and retention. One of the items included funding to help stabilize further the childcare providers so that it would attribute to recruitment and retention. This is the item thus far that has been awarded. You're welcome.
Further questions on the item? I'll entertain a motion to adopt.
Move to adopt.
Senator Gray moves to adopt the item. Senator Bradley seconds. Further discussion? Seeing none. All in favor say aye.
Aye.
Opposed, no. How many noes? 2. So we have 8-4. Motion is adopted. Moving on to tab 11. Item 23-114. Did I skip one? Thank you. 23-134 was still remaining on tab 10. All right, this is Health and Human Services. Any questions on the item? Senator Rosenwald.
Thank you. MMIS on page 5 is scheduled to get more money. Just, it seems like a sinkhole. And it just is such a giant amount of money in the budget every year, and then items like this. Why?
So, as we'll be discussing on Monday or Tuesday, I believe Medicaid is coming to Senate Finance next week. The maintenance costs for the MMIS system are significant, approximately $80 million or so over the biennium. The transfer that we're requesting here is to fund a recent amendment. And Henry, I don't know if you want to speak to the details there.
Sure. One of the major pieces of this is a function of when providers query the system and get a response on people's eligibility. As you know, our enrollment in Medicaid went from 178,000 to 250, almost 252,000 at its peak. And now with the unwind, there's a lot more need for providers to be able to reach out and check people's eligibility. And we, in terms of what was in the original amendment to fund that type of service and interaction with the system, we need more opportunities to do that. Otherwise, providers will try to query and they won't be able to get out and get a response.
Further question?
If I might,
Senator,
Mr.
Senator
Chairman.
D'Alessandro.
Thank you, Mr. First of all, thank you for your explanation. The MMIS system has been problematic.
Senator, you hit the mic off.
The MMMI system has been problematic for many, many years. And we talk about this at fiscal, we talk about it during the budget cycle, we talk about appropriations, we talk about the match, we talk about what's being done. Isn't there any way where there could be some uniformity across the country with regard to this system? Because everybody has to make these reports. And isn't that an opportunity to get something that makes sense? Other than that, these kinds of appropriations, even though they're significant matches, and I'm not, I understand that. I mean, it used to be a 90-10, and now I don't know what the matches are. But indeed, every year we look at this, and you give us good rationale. I understand that. But there's got to be a more uniform system in place that everyone that must report is able to take advantage of. I just find this to be incomprehensible. I was in the software business for a while, and we were able to do things like that. But this occurrence goes on and on and on.
So I guess I'd like to answer in two parts. I guess the first part is when you've seen one Medicaid program, you've seen one Medicaid program in many respects. Unlike software you can take off the shelf, that's not the case, because as each state has little idiosyncrasies with respect to how they want the the eligibility to work and other things. The reality is that you can't buy, in many instances, information off the software off the shelf. I guess I would also say that I think of Commissioner Goulet's here, that the operation of the system today has vastly improved in the last few years. And the second thing is that, in which we'll be talking to you at the Senate Finance about, is whereas, I think the original system was installed and acquired when we were in a fee-for-service system. So after we made, and this is long before my time, after we made that investment, we converted to a managed care approach, which required a lot of rework to get the system to line up with that. But that's just an example of, when you buy it for one function and then
Sure.
put it to use in another function, it does require a lot of changes. But in terms of how the system is functioning, it is I think if Commissioner Glaze behind me, I think he would shake his head yes, and I've heard him say it at Governor and Council, because the same kind of concerns that you raise come up at Governor and Council as well. But the other thing that I think from a forward-looking standpoint is the strategy of modularity, meaning that rather than relying on one vendor to provide everything, and when you go out to bid, you're making a massive commitment to one vendor. The strategy going forward is to put it in pieces so that you can create more market competition for the components that you're buying, and that's the direction that we're going in. And that's honestly in terms of what CMS will support, because they've seen these massive systems that are singular vendored have not been inexpensive to run, that they're trying to create more competition by creating different modules that get pulled together.
Okay. Thank you.
Senator Rosenbaum. for
Thank
question.
you. Separately, we're, by approving this item, losing $10 million of federal funds.
That's a different
Sure.
item. But
Well,
that's
it's
related
not the
to the,
MMIS.
it's not
but-
related to MMIS. I just
But
wanted to
it's
clarify.
this item. What programs or services might be affected by the loss of
Sure.
this $10 million?
So there's a couple of transfers within the Medicaid accounts that you'll see. We're moving funds to CHIP based on higher enrollments and the need there. We're moving it out of the main Medicaid account, so the 7948. We have additional dollars as a result of the 6.2 FMAP that just phased out April 1. Now we're at 5% for the time being. The state phase down payments that you see there, those were under budgeted in the current biennium. We do have a prioritized need request that has gone unfunded to date of $15 million for the current biennium. We don't receive any match on that payment. It's 100% general funds. And so by moving that out of the 7948, we're reducing the 50-50 match, and that's the $10 million of federal funds that you see in the reduction there.
Thank you.
You're welcome.
Further questions?
Thank you, Mr. Chair. So I have several. I'll give you what should be an easy one first, but I'm interested if you can answer it. This makes reference to account number 5191, Special Medical Services. I could not find 5191 in any of the documents that I have related to DHHS.
5191 is within the Bureau of Developmental Services. It's the Special Medicaid or Medical Services. It is contained within the spreadsheet on page.
So I can't look it up right now because I don't have what you'd have, but I'll tell you where I did look it up. I didn't see it. I have an actual spreadsheet for the HB1 as it passed the House. It's not in there. And I also have a document produced by LBA, which is on their website, which compares the governor's request to what we did in the House. And I couldn't search for it in there either. And I could search for anything else. So
If you look at the current House Bill 1, it is on page 618 of the current operating budget.
okay. Page 618, is that what you said?
Page 618, correct.
Thank you. All right, I guess that was the easy one. Good. So now I'll get to the ones I really care about. So 7948, which is Medicaid services, and you talked about a lot of money coming out of that one, correct? Okay, $13 million, if I'm not mistaken, which says that there was $13 million in there that would have lapsed, or that will lapse. And I'm just curious as to, oh, and I might add that $13 million will lapse in that account this year. You requested and we granted, if I'm not reading this incorrectly, for FY 24-25, an increase of $25 million in year one and $35 million in year two. So we're potentially lapsing 13 million from a much smaller budget, and we're still asked to increase the budget over the coming years. So really, two questions: why was the 13 million not brought up during the budget cycle, and why was so much asked for in the next biennium?
Sure. So when we're looking at the Medicaid program, we're looking across all of the counts and the projections that we're seeing. The state phase down has been a known shortfall that we've had since July 1 of the prior state fiscal year. So when we look at those calculations, we make that assumption with what we're going to be carrying forward or what we'll have available to lapse.
So 7948 is the state phase down account?
No, it is not the state phase down account, but when we look at the entirety of the Medicaid program, CHIP, standard Medicaid, state phase down, we're looking at those numbers in totality to figure out what are we going to be needing. Are we going to be short? Are we going to be lapsing funds?
Well, that's great, but we're talking about one particular account, 7948, which apparently will lapse 13 million if we don't approve this, number one. And number two, in the next biennium, it's budgeted at $60 million more than this biennium. So can you just speak to both of those? How can you square both of those circles?
Sure. With respect to the 22-23 budget, the assumption was that the federal public health emergency and the beginning of the unwind would start in October of 22. It's starting in March of 23, actually effectively April 1st of 23. So that was one sort of unknown to all of us. I think throughout the sort of that period, there was every 90 days it had to be reauthorized, and there was no clear signal in terms of what would be expected. So that was our best sense of it when the budget was put together for 22-23. We also, with respect to the 24-25 budget, the FMAP percentage, right, is in the Consolidated Appropriation Act is being reduced from the 6.2% to the 5 to the 2.5 to the 1.5. The criteria in which we had to do the unwind was also not known as what we've been, finalized as, that you can only do 1/9 of your population. So that's another factor that goes into it. We have a request in the current budget because we're concerned about the unwind and how fast we're actually able to unwind and what level of appeals. So far in the unwind, with 1 month's experience, it's gone according to plan, but it's pretty early in the process to conclude how it's going to play out, because the way we approached our unwind was on a risk basis. Those people we thought most likely would close because they were over income or were likely ineligible or had not used any services in the past year. That's who we started with. So the likelihood that they're going to close and stay closed is high. As we get into the more challenging populations, the people that have coverage and have shown use of medical services, I think the variability in how that's going to play out is a little bit more unknown, and it's certainly something that we would want to keep you apprised of as it goes along.
So it sounds like you're saying that this increased FMAP was more than we needed to cover the expanded populations under the emergency situation. But as that goes away, it's going to, the remainder of the funding that in other words, the equivalent funding we have right now, this biennium, is not going to be enough to cover the lowered, theoretically, as we phase people off, to the extent of $70 million.
So the unwind will run through December, okay? And then there is medical inflation that is occurring, and then there was some anticipation. So we figured we could operate within about a 3% change in sort of medical inflation, and then whatever with respect to some level of rate increase we anticipated in terms of, at the time, early on, about a 3%, which turned out to be a very low assumption for 24-25, given what, has come to be known of the workforce shortage being even more severe than when we started planning for it. But that's why you're seeing an increase in the 24-25 budget. Certainly, to the extent that our contracts are not, they're price limitations, if you will. If we spend less because we do better on enrollment and what have you, that money isn't going to be spent except to cover something like a known shortfall. This particular shortfall is a little bit hard to work through, and I understand there's so many issues that come at the committee I'm working through, but this is a fixed dollar amount that we're told that we have to pay for drug coverage for people who are duly eligible in the Medicaid program. It's a fixed premium per person per year, per month.
Yep.
And so when we bring forth the number, I understand it's been hard to take everything in, but that one is, I think it's been several bienniums where we haven't been able to make a good case when we're presenting it enough to convince to budget directly for that as opposed to covering it in a different fashion.
One last question. First of all, the last part you didn't understand, but I'll deal with that later.
Okay.
But more importantly, for this note as a whole, and we've seen these several times over the past, since I've been doing this, and I've asked, pretty sure I've asked, maybe you've forgotten, that I'd really like to see actual spreadsheets provided to LBA when you have notes like this, so that I can actually understand where the money's coming from and where it's going to. It was not easy for me. I understand that you got a lot of verbiage in here and you got some pictures that sort of show some of it going on, but it's not really clear what's happening. I'd really like to see that so I can actually have something I can study to understand where it's coming from, where it's going to. Because I'm always curious, as I was just asking about here, how did you happen to have so much money in this account that we were unaware of, in particular just as it went through a budget cycle. So that's just a commentary that I really hope that you'll please do that in the future. Thank you.
We'd be happy to do that.
Senator Rosenwald for a question.
Question about the state phase down.
Yes.
If we've known since July, and I'm not sure which July, maybe it was the beginning of the budget, that we had a shortfall, why did the department lapse the so much additional FMAP along the way through last fiscal year? I think it was something like, I know it was more than $30 million, but it was maybe more than 50. Why didn't we hang on to that additional revenue and supplant general funds along the way to make up the difference in this phase down?
So we have to pay the federal government with general funds. Where these payments are made to CMS, and we're prohibited from supplanting federal funds and general funds. That there's a prohibition on that, so we're not allowed to do that, which is why we're asking for the transfer here. Yeah.
Further questions on the item? Senator Gray moves that we adopt item number 134. Senator Bradley seconds. Is there any further discussion? All in favor to say aye. Aye. Opposed, no.
No.
One no. The item is adopted. Now we'll move on to tab 11. A voluminous report of vehicles that didn't achieve the minimum required mileage. What I would like is an explanation of why. I remember when this was 12,000, then it was 10,000, now it's 8,300 per year, and maybe an explanation of why it has come down year over year, and also curious, have we saved any money from all these miles that haven't been driven?
So good morning, Sherry Rockburn, Assistant Commissioner, Department of Administrative Services. So there's a formula that we used, and we use it each biennium to calculate the mileage, what we call the benchmark mileage. So as you remember, as you noted, Chairman, 10,000 at one point, it's down to around 8,000. And that formula is based on what we're actually spending in costs. So we have direct cost and operating costs that we use, and we look at the federal reimbursement rate to calculate an average cost per mile. The spreadsheet is the very last page in your packets if you want to take a look at it. So some of this is just a function of the formula. It's not an arbitrary mileage number that's generated. We actually calculate the mileage based on sort of the average number of vehicles we have, the average cost that's happening, and the change in the federal reimbursement rates. And so just as a comparison, I'll just give you a little background is while this year, this waiver is for 119 vehicles that fell below that mileage that agencies had to ask for directly to retain those vehicles. Last year, the number was 165 vehicles, and the year before that was 111. So just to kind of give you a reference of, is 119 high, is it low? It's, somewhat in between the last 2 years. So over the 3-year period, this number hasn't fluctuated significantly. As you know, the federal mileage rate has traditionally been increasing about every 6 months or so. So that's really the nature of this. We don't determine, I'll say exactly if an agency should keep it or not. We ask the agencies for input for whether they have a need for that vehicle or not. In terms of savings, I think the hard thing is while the mileage driven has gone down, as you know, the gas price at the pump has not. So I think that I wouldn't say we've had a significant savings, even though the mileage has been lower.
Was that statement no significant savings?
No significant savings, correct.
Is there any possibility as you go through these year after year from same agencies that have low mileage vehicles that they could do without one or two, especially where they have pool vehicles and there are always 5 vehicles and there's 2 or 3 of them that don't make it every year. Why do they need them?
We can continue to scrub that information when it comes to us. We do ask each commissioner to submit information to our department with a justification as sort of why they need those vehicles retained. Those letters are attached to your fiscal packet if you wanted to look at any agency individually, and they probably could speak to it better than us. We really ask for their input directly.
I read a lot of them and they all seem to sound the same about COVID and working from home and that sort of thing for this last year. But it seems like perhaps going forward, if they're not using these vehicles as much, they don't need as many. So
we can
and
work with them on
I remember
that.
at a time when we went to just 4-cylinder engines and small cars. It doesn't seem like that trend has continued.
We've tried a few different things in the fleet pool. We've also tried to look at leasing vehicles instead of state-owned, and that didn't produce the savings that we had anticipated. I think this past year, we've also struggled with, as most individuals, the supply of vehicles. So some of the vehicles that we've traditionally have requested at dealerships, have been a little bit limited as well. So that's been a little bit of a struggle.
What I didn't see in here is the total number of vehicles you're tracking.
I did have that. I believe that there is, and it's on a very small print on one of the pages, about just over 700 vehicles, 721 vehicles.
Thank you. Further questions from the committee? Seeing none. Are you ready to adopt the item? Representative Leishman moves the item. Senator D'Alessandro seconds. Further discussion? Seeing none, all in favor say aye. Aye. Opposed, no. That report is adopted. Thank you. Moving on to tab 12. Liquor Commission is closing a store. Any,
I have
any
some,
questions on the item?
I have some questions, Mr. Chairman.
Representative Leishman has a question on the item. See Commissioner Malika here.
Morning, Mr. Chairman, members of the committee. For the record, I'm Joseph Malika, Chairman of the Liquor Commission. With me is our COO, James Vera, and CFO, Tina Demir. So we'd be happy to answer any questions you might have. Thank you.
Thank you,
Representative Leishman.
Mr. Chairman. Thanks for taking my question. So I noticed in your narrative, this store was not one of your profitable, it was one of your least profitable stores. And it was interesting to see that they'd had some flooding issues there and so forth. I guess the concern I have is picking a store that's at least profitable, and especially in a community that borders Massachusetts and not too far from Vermont, the impact that has on the community of Winchester, which is a struggling town. So I just curious about your comments.
Well, it was the least profitable store, the least profitable full-time store when we closed it. It had 2 full-time employees and 5 part-time employees. And it's very close to the Keene store and the Hinsdale store, which are both much larger footprints. This store was about 4,000 square feet. At the time, the Ashlot River flooded the store. We closed the store. James was in contact with the landlord, who refused to pay any damages. And then we used the store as a storage facility for some shelving and other things. We moved the product to the larger stores in the area, which are millions of dollars higher in sales. So I think to answer the question as to the effect on the community, I'm not really sure that it had an effect on the community as far as what we do, as far as the business that we are in, because we have stores that are a couple of miles away and serve those customers in Hinsdale on the Vermont border, in Keene, in Rindge, all within that area. And as you know, that area had a plethora of small stores for a number of years, quite frankly, underwhelming and underserving the community. And we are trying, as we did in West Chesterfield, as we did in Rindge, as we look forward to do in a couple other communities out there, to build larger stores that are more impactful for the consumers that come here from out of state.
Thank you, Mr. Chairman. Thank you.
Thank you, Representative.
Further questions on item 115? Senator D'Alessandro moves to accept the item, and Senator Bradley seconds. Further discussion? Seeing none, all in favor say aye. Opposed, no. 1 no, the item is adopted.
Thank you, Mr. Chairman, members of the committee. Have a wonderful weekend. Thank you.
You as well. All right. Tab 13, item number 23139, Department of Natural and Cultural Resources. Any questions on this item? Seeing none, are you ready for the question? I'll entertain a motion to adopt 23139. Senator Bradley moves, Senator Ennis seconds, that we adopt item 23139. Further discussion? Seeing none, you ready for the question? All in favor say aye. Aye. Opposed, no.
Who's second?
INNIS. Innis.
Who are they in for? Hi. Who are you replacing?
He's replacing Birdsell.
Thank you.
Okay. An item on tab 14. New Hampshire Veterans Home 23116. Transferring some items. Any questions on the item?
Move the item.
Representative Leishman moves the item. Senator D'Alessandro seconds. Further discussion? Seeing none, all in favor say aye. Aye. Opposed, no. That item is adopted. Okay, it looks like the one I have on top is the New Hampshire Youth Development Center, 23-140, and we have the Honorable John Broderick here for any questions.
Excuse me, Mr. Chair, there's two items. You mentioned the YDC item, which is informational only. You do have one action item, which is the 23-141 that you may want to take a vote on prior.
Very good. All right.
Sorry.
I guess I have them both here. All right, so Fish and Game is an action item. 23-141, that's a late item. Transferring 115,000 to the operating budget. Any questions on the item? Senator D'Alessandro moves the item. Senator Bradley seconds that we adopt item 23-141. Further discussion? Seeing none. All in favor say aye. Aye. Opposed, no. The item is adopted. Mr. Kane, any later action items?
That was the last action item.
Okay. Any questions while we have Judge Broderick here on the, you have a question? Senator Rosenwald has a question for the judge.
Thank you so much. Thank you for being here. My question is about the expenses of your office. When
Senator, I'm going to apologize up front. I've had a bad cold. My wife thinks I'm ignoring her. I'm not.
We'll
But
tell her.
I'm having trouble hearing.
Okay, I'll try to speak loudly. My question is about the expenses of your office. When I total up your report and your expectation for this year, it's somewhere approaching $1 million for this year. Just wondering if you project the same level expense for the next 2 years, or if you have a sense of what the expense of your office will be that will be deducted from the fund.
First of all, thank you. It's a very good question, and it's perplexing to us. I've been in that office now for 3.5 months. We have received claims as we've identified. This committee knows probably better than I the backstory on all of this that brought about this YDC claims office. It's hard to know at this point how many claims will find their way to our doorstep. Of the claims that have been filed to date, with one exception, none of them are cases that are already in the Superior Court. So part of the intention of the fund, I think, was to have cases migrate from the Superior Court to the Claims Fund, of which there are about 800. The claims we have received to date, with one exception, have not been filed in the Superior Court. So that group of cases, which are hundreds and hundreds, are remaining in place. And so it's hard to know whether they will migrate in time or not. And if they migrate in time, our office will be busier than it is now, and expenses that we tried to project were expenses of an office that's doing a very good job with a high level of cases. If we don't have the cases, expenses may be less. It's just hard, Senator, to know after 3 months. I would say, just as a data point, the first trial in the Superior Court of one of these sex abuse cases has apparently been scheduled for April of next year, 12 months from now. The lawyers involved in that case, and the lawyers who have hundreds of these cases, I have no idea the severity of them. I don't know them. They may decide to stay put. they may decide to say, let's see what happens. Next April, we'll have a jury trial. And depending on what happens there, we may be doing a lot more business in the claims office. We may be doing less business. And in the backdrop of all of that is the statute of limitations, which this legislature wisely created. So the statute of limitations for filing a claim with us is the end of December of 2024. The first trial in the Superior Court, unless it's resolved, will be April of 2024. Depending on the result in that case, depending on whether it's appealed to our Supreme Court, I have no idea. The statute could run while that case is still alive. And so if lawyers are waiting to see what happens in the court system, by the time they realize, good, bad, or indifferent, the door may be closed here. So the claims process, as you well know, doesn't go on forever. What I would be interested in doing, and I think you know, you created the job, and I give you kudos, I mean that, for creating this. It was exactly the right thing to do. There's a fair amount of misinformation out there. There's a fair amount of ignorance out there about what this is really about and how it's really going to work. This legislature decided, and I think wisely, to create this fund, to do it in a way that was trauma-informed. It's critically important, and everyone saw that. The court system, as you know, as good as it is not trauma-informed. It's often trauma-inducing. So in terms of what we're trying to accomplish here, what you put in place, I think is exactly right. If the legislature is interested in hearing from a neutral, I am totally neutral here. I do not have a horse in this race. I'm proud to be the administrator. I want to do the right thing. And I'm pretty circumscribed by the statute with the caps. I'm not complaining. That's what it is. But over the last 3 or 4 or 5 months, I've had a number of discussions with counsel. I've had one meeting with all counsel, or about 8 or 10 of them. I have most of these cases. I have another meeting scheduled with them at the end of this month. I've been reaching out to the Department of Corrections. I mean, I've really been trying to touch base with the stakeholders. I want to learn as much as I can. But at the end of the day, my interests are exactly the same as yours and the same as the people who were sexually assaulted or physically assaulted. And I want to resolve these cases in a trauma-informed, confidential, if the claimants choose to keep it as such, and most will, I believe, process that's reasonably prompt, trauma-informed. But if you're interested at some point, I know you have a long day today, after 3 or 4 months of dealing with it and having those conversations, I do have some thoughts about what you might consider doing to bring more people into the system. Some of them I think would cost nothing. Some of them might cost something in some of those cases. But as someone who's running that office now, and knowing the intention of this legislature, I think it would be profoundly sad 20 months from now to have the fund close and not many people who came into the system. At that point, the only place to go is the court system with all its attendant stress and all its attendant press. And at the end of the day, that won't accomplish what you want, in my view. It certainly won't accomplish a trauma-informed resolution. And so if there's interest at some time, I'd love to sit down with all of you, some of you, just to share some thoughts. Obviously, you're free to reject every one of them. I understand that. My goal is to make this work, because the system you've created, I think, is inherently fair. I don't have any doubt about it. I wouldn't be associated with it if I thought otherwise. I know a lot of people here did a lot of hard work to get to this point. The Attorney General has been very cooperative with our office. I'm independent, I'm neutral, but I deal with the Attorney General's office. I deal openly with claimant counsel. I want this system to work. And I think it may require some adjustments to meet the goals you want. And if there's ever any interest, I'd be happy to talk to you about it.
Further questions from committee members? Seeing none, we look forward to further reports. Thank you, Judge.
Mr. Chairman, did you say we're all done?
Yes,
Thank
thank you
you.
very much.
Thank you. It's been a while, Mr. Chairman, since I've been here. I apologize, but my wife will vouch for it. I can't hear that well right now. Thank you very much.
Thank you. There are further informational items. Does anybody wish to have questions on them? Seeing none, we're ready to move on to the audit. Get this book closed.
Good morning, Mr. Chairman, members of the committee. For the record, Steve Smith, Director of Audits for the LBA. We're here to present the annual single audit of federal expenditures. As you know, our office retains KPMG to perform in this audit. So with us from KPMG, the partner on the engagement is Marie Zimmerman, and also Dana Call, our state controller, for any questions and comments she may have. So
Thank you.
we'll have KPMG present their audit.
All right. Good morning, Chairman, Senators, and members of the committee. My name is Marie Zimmerman. Thank you for the introduction, Steve. I'm presenting to you today the results of the State of New Hampshire's federal single audit for the year ended June 30th, 2022. This is, as you know, a compliance audit. The total federal expenditures reported on the schedule of federal expenditures and awards was $3.5 billion and was approximately $1 billion less than the year before. That is primarily related to the decrease of COVID funding, of which $900 million was directly related to the unemployment program. Section E is where the CFA is located in your bound report with the green cover. And on page 1, you will see the schedule of federal expenditures and awards, which is listed by federal agency as well as ALN number. The total expenditures also included within the total expenditures as required to be reported is the amount of the pass-through to subrecipients. And this year there was a total pass-through of $783 million. The CFA is prepared by the state. As a part of the audit, we review the CFA and perform a variety of procedures to determine the completeness and accuracy of the CFA, that it was properly prepared. As a part of our opinion, which begins on page D3, we concluded that the CFA is fairly stated in all material respects in relation to the basic financial statements as a whole. We previously presented on the basic financial statements and provided a clean opinion on those. As outlined by the Uniform Guidance requirements, we are not required to audit every program on the CFA. Instead, we are required to focus our audit on certain large dollar programs as identified as Type A programs and higher risk Type B programs per the Uniform Guidance. For the year ended June 30th, 2022, the Type A major program threshold was $10.6 million, as shown in our summary of audit reports on page F1. The amount is noted, the summary of our audit reports begins on page F1, but the amount is noted on page F3. That threshold determines our Type A programs. There was 25 federal programs for the state that had received funding or expenditures incurred of greater than $10.6 million. The largest being your Medicaid program at $1.8 billion. The Uniform Guidance requires auditors to perform risk assessments over each program that meets or exceeds that Type A threshold to determine which programs will be audited. Once the Type A threshold risk assessment determined, risk assessments are performed over the Type B to identify which programs will be determined high risk and subject to our audit. This year was unique. The federal government, as you know, deemed 10 programs to be higher risk. Historically, only Medicaid was deemed higher risk. So taking this into account and performing our required risk assessment process, we identified a total of 19 major programs. As you may recall, that is greater than the previous years as audited programs. Of those 19 programs, 16 were Type A programs, and three were Type B programs. The Type B programs, all three of them, were deemed higher risk programs by the federal government. Those were Airport Improvement Program, Federal Transit, and then Provider Relief. In addition of the 18 audit programs, 10 of those had been audited in the previous year, the June 30th, 2021 audit, and were required to be re-audited as a result of the findings in the prior year audit. Those include Medicaid, Title I, Unemployment Insurance, Corona Relief Fund, Emergency Rental Assistance Program, Education Stabilization, SNAP, TANF, ELC, and LIHEAP. As a result of our audit procedures performed, we identified 32 reportable findings related to the Uniform Guidance audit for this year. Of the 32 reportable findings, in our opinion, is outlined in Section D of the report. 24 of those findings are considered material weaknesses in internal controls. 8 of them were considered to be significant deficiencies in internal controls. 24 were considered to be material noncompliance, of which 6 of those related to the reporting compliance audit area, 5 related to subrecipient monitoring, and 5 related to special test. The good news of these 24 findings, none related to allowability or eligibility compliance areas. I do want to point out that 10 of the 24 material noncompliance findings are within 3 programs. I know one of them you've already noted today, which is LIHEAP. Also TANF, and then the Small Business Credit Initiative Technical Assistant Grant Program. Of the 32 findings reported, 13 of them were repeat findings from the prior year. Of the 32 programs, 3 this year had question cost. Special Education Finding Cluster had a question cost over a period of performance in the amount of $124,000. TANF had a special reporting compliance finding resulted in question costs of just $222, which did not rise to a material noncompliance. And then TANF had a question cost in the amount of $13,530. I just wanted to draw the question cost to your attention. Based upon the results of our audit procedures performed, we are required to provide an opinion related to the compliance of each major program audited. Based upon the internal controls and compliance identified, as shown within our summary of audit results, we issued a qualified opinion over 13 of the 19 programs we audited. Those were the ones that were considered the material weaknesses and material weakness in internal control, as well as the material noncompliance. An unmodified or clean opinion was issued over 6 of your programs. And the good news here, the story to tell, is those were some of your largest new COVID funding programs, such as your Provider Relief and American Rescue Plan, your Pandemic EBT, your Airport Improvement, your CRF fund, as well as your Federal Transit Formula Grant. Of the 13 programs that received the modified opinions, the unqualified opinions, unmodified opinions, 7 of those also received unmodified opinions qualified opinions in the previous year. Those would have included, so they were qualified last year, they're qualified this year. These 7 programs include SNAP, Emergency Rental Program, Education Stabilization, ELC, TANF, LIHEAP, and Medicaid. Of the 13 programs that received modified funding, 10 of them had COVID funding as well. The findings themselves begin on page F4 of the report. The first finding relates to our financial statement audit I had previously presented the results of those findings as related to Unemployment Compensation Trust Fund in our presentation earlier in this year. For each of the findings included in the report, management is required to provide a response to the findings, which is also included at the bottom of each of the findings, as well as their corrective action plan to resolve the matter. The corrective action plans are presented to contain within the report. As outlined in our opinion, the state is responsible for preparing the corrective action plans, and the state's responses were not subject to our audit. And as such, we do not express an opinion as it relates to those corrective action plans. Does anyone have any questions? I know I covered a lot, but I know that you had detailed knowledge of the report.
This is a monumental effort. How many auditors were involved?
My team, we consist of approximately 40 professionals between IT and CPA audit professionals, as well as LBA staff to assist us.
I knew it was almost more staff than Mr. Smith has. So, questions from the committee? I guess when they dump all this money on us at once, it's difficult to figure out where it all has to be reported and how it's reported. And some of these things that I read were very difficult to follow. All of a sudden, you're a pass-through, whereas before you were a distributor, and now you have all these other things that come up that, you know, and you fail to, and looking for disbarment on someone that you're passing things to. What if they're not a lawyer? Can they still be disbarred?
Well,
I mean,
suspended or
I read
disbarred
these
for
in
the
several
companies,
places
yeah.
and wondered, this is a person that doesn't do any law work, why would they be disbarred? So is that a term used in other areas as well as law?
Yes, it is. So the federal government has deemed that entity, that not-for-profit, as having not reputable and should not be receiving federal funds. So
That's what I assumed disbarment was a wider net than what I originally assumed.
Yeah.
So appreciate all this information. Obviously, it's been difficult every year. This summary page is appreciated that tells us what's going on in previous years. So it's not an easy task when they, especially the amount of money that gets dumped, and I don't think we get much warning. And then there's a whole new set of rules. So I think the groups have done pretty well considering all these problems that have suddenly you got a bunch of new money and it's got to be dispersed right away and you got to report right away, and we're short of people. So
and you have to set up the policies and procedures in accordance with compliance. And so that's really a story to tell that management, those were clean opinions over those programs, that management really put in the level of effort necessary. Because if you look at your bulk of your findings, they're over the long-term existing programs.
And Mr. Chair, if I may, Dana Call, State Comptroller, I do just want to recognize all of the finance staff that, in addition to the programmatic responsibilities, the finance staff at these agencies, many of which did not get additional resources that came with these funds. As you look through the actual CFA expenditures, you can see that COVID-19 money that is highlighted in each category, some of which has been infused in additional already existing programs, but they got an influx of additional funding, perhaps with no additional resources to manage those funds. So I do want to recognize the agency staff as well as my staff, led by Steve Giovanelli, who has been preparing this monumental book for several years, and after his stint with Gopher, came back to us and was able to pick right up, and we're really pleased that the findings have maintained at a reasonable level that we think we can manage going forward. So, thank you.
Senator Gray.
My concern is the repeating items, not only on this audit but other audits, and I haven't been able to pin anybody down, whether it's administrative services or somewhere else, that needs to be the one that tracks these things and looks at them, current status, et cetera, you know, plan of action, milestones, those kind of things, because we shouldn't have all the repeating items that we've had in the last few months. So, thank you.
Yeah, thank you for the comment. Excuse me. And we do, we have at Administrative Services have a corrective action report filing status program that we work with each commissioner to engage them in really following up quarterly on these findings. We did have some slippage in that because of the movement with our staff over to Gopher, and now we're going to pick that back up. So I do think it falls on both equally. It falls on administrative services to monitor and for the agencies to actually implement their corrective action plans, but we do have a tool to monitor that.
Follow up just after the budget's done, come see me.
Excellent. I will.
Thank you.
And if you have a follow-up report, we'd be interested, especially on these items that recur. Further from the committee members. And I forgot to welcome Senator Innes as a replacement.
Thank you for having me.
And also on our side, we have Representative Mooney sitting in for Representative Edwards. So, and as usual, I have my faithful alternate members here always to make sure they stay up with everything, and I appreciate them being here.
Representative Heath, sitting for Representative Wallner.
Representative Heath sitting in for Representative Wallner. I'll recognize Representative Erf for a motion.
Move to accept, place on, oops, no, go ahead.
I was just going to ask to do that.
Thought I was gonna say move to adjourn?
Accept the report.
Move to accept, placed on file, and released to the public in the usual manner.
Is there a second?
Second.
Second from Senator Gray. Further discussion? Seeing none. All in favor say aye.
Aye.
Opposed, no. Thank you for all that busy work.
That's a long term.
Just one more item, Mr. Chairman, just the date of the next meeting. The third Friday in May is the 19th.
We will have a session on the 18th, so we will have finished up a lot of the stuff in the House. How about the Senate? Any more convenient time? Or you wish a different day?
The Fallen Law Enforcement Officers Memorial Service
Is that on the 19th?
is the 19th at 10 a.m.
Same time we'd be starting.
Mhm.
That's happened a number of times. We've had the meeting as well.
Hasn't interfered?
Less than 2 weeks.
It might be hard to find your way into the parking garage, but
Can I ask you a question?
Those of us who have been on this committee know that we've done it.
Yep.
And the idea is trying to move things is problematic because of other things.
that's right, because you'll have other things going on.
I have a question for the committee. It seems somewhere along the line, we switched from being the second Friday to being the third Friday. And the third Friday has traditionally been our executive committee meeting in the county, which I've not been able to go to for a while now. And I'm just wondering, is it a problem to put it on the second Friday?
I thought it was always the third Friday.
Well, something definitely changed because on the second, well, maybe you're all right, maybe you're correct, but on the second Friday, I had the judicial retirement meeting, and that hasn't changed. In fact, I had them move it till later in the afternoon so that I could go to do this in the morning. If it's possible to change, it'd be great. If not, I'll just deal with it. I'll just tell them.
If, would you be done with your meeting by noontime?
Yes.
Is it-
On the
believe
second,
on the
on the second Friday, though.
I believe
Not
on the
third.
19th, there's already meetings scheduled for
The
several
afternoon.
of us in the afternoon. Health and Human Services Oversight Committee is in the afternoon.
This is why I brought up the second Friday. I was hoping the second Friday would work better for people. Would that be the 12th?
What do you have on the second Friday, the 12th?
Nothing. Well,
Oh, well, okay, fourth would be different than the third too. It's the fourth? I'm sorry, I said the fourth.
might have a dentist appointment that
No, it used to be the fourth. Okay, the fourth. The executive committee used to be on the fourth? So they switched to the third? It's today. Today's the third. No, it's been this for,
So your Hillsborough County is not on the 19th.
okay, I guess not. No, it is on the 19th, apparently. No, 26th. I don't believe you because I've missed it like 3
All right.
times because of this.
All right, so that's not a problem. The 19th, 10 a.m. All right, let's make it 10 a.m. on May 19th for fiscal. Any idea, Mr. Kane, will there be a lot of items, or are there any, Mr. Smith, will you be bringing in several audits, or maybe one or two? One at the most, okay.
You'll start to pick up on the number of items due to the end of the year. So you're probably still in the-
Anybody's guess.
It's a little heavier than this. I would guess in the 40 item range for the next couple of months.
But we were successful in covering most of them on a consent calendar, so maybe that will continue. All right. May 19th, 10 o'clock, next meeting. Anything further for the good of the order? Committee is adjourned. Thank you all for coming. You're gonna do what? Yeah, bring me that page. All right, so when I have all my stuff together, I'll get together with you sometime next week, show you what they're asking me to propose.
So it has number in there. Yeah. And I sent him. He called me. Emailed.
What would you like?
And then.
Representative Burke.
Right.
Might turn it off.
I said,